Good morning, everybody. My name's Brett from Real Response. I'm the head of the Tactical Medical Department. And thank you very much, Sam, for giving us that very good in-depth lesson on how to manage a fracture. And as Sam mentioned, we just want to quickly touch on some of the considerations when operating in a military context or even just a high threat environment, whether you're working in that industry. It doesn't always have to be military, okay? Essentially, everything you've been taught, nothing really changes in terms of the anatomy, the physiology, what's going on internally, what your end goal is. There's just a few considerations about how we do this and when we do it, and things to be aware of when we are applying a traction splint, especially in the field or in a high stress, high threat environment. A few things to be aware of. Just always fall back to your TCCC or your tech principles. All right. So first and foremost, if you're in a direct threat or the care under fire phase, our number one goal is to obviously suppress or neutralize that threat and get to a safer area. Okay. So we're not going to be doing a whole lot of medicine in that space. So no matter what environment you're in, your ultimate goal will always be to achieve best practice medicine in a safe manner. Okay. So key considerations: mechanism of injury, the danger within the environment, evacuation considerations, pain management, prophylactic antibiotic treatment, and equipment storage and preparation. So first and foremost, the mechanism of injury, it gives us a good idea of whether we're actually going to be able to consider putting a traction splint on, and just thinking back to your contraindications, making sure there's no further injury to the lower part of that limb, the knee, so we're able to apply enough tension if we are going to be putting one of these splints on our patients. The danger, that just comes down to our principles for tech and TCCC. If there's a direct threat, if you're in the care under fire phase, we're not going to be spending 5 or 10 minutes getting our CT6, CT7 out, trying to put it on the patient's leg. Okay, that's just 101, very basic stuff. Do not keep your head down when you're in the direct threat or a care under fire phase. Okay, you should be up, looking around, communicating with your team, trying to manage and suppress or neutralize that danger. Evacuation. Okay, so this just comes down to, is putting a CT6 or a traction splint on right now the best option? Okay, do we have the resources or do we have a stretcher to put our patient on? Is it going to be more difficult to extract them with a splint on, or unfortunately, is it better to maybe just load them up with some pain meds because our extraction method or our evacuation method is not going to allow us, or it's going to make it a little bit harder to manage if they do have a traction splint on. Okay, again, all this treatment is going to be delayed to the care under fire phase, the tactical field care phase, or the indirect threat or the warm zone. Okay, prophylactic antibiotic treatment. Again, it's something we want to be thinking about, and if you're able to do it, please initiate it. Okay. Obviously, we want to be able to stop that blood loss, like Sam mentioned, with that muscle changing shape due to the femur breaking. Okay. But if we've got time, if we're able to do this, please start thinking about, can we get some of this on board, and is it safe to do that? Okay. Equipment storage and preparation. Even playing with these devices in a low stress, when it's a well-lit room, your patient's nice and calm, they can be very, very fiddly. So just remember to always train how you fight. If you're going to be working in a low light environment, if it's going to be a night operation, if you're going on to night shift and you are carrying one of these, maybe practice putting this on your patient in a low light setting, okay, and get familiar with it, understand how it works, because it is going to be a lot more difficult, especially in a high stress, high threat environment. So some of the considerations we need to be aware of, splinting fractures will be delayed until the tactical field care phase. That just goes without saying, okay, because it is going to take time. So always delay it to when you have that, when there's a safer option to be able to do this, or you're in a safer area, okay. Applying a traction splint or any splint of that kind during the care under fire phase will just be detrimental to yourself and your patient. Again, that just goes without saying. Focusing on your principles, basic stuff, okay, neutralize, suppress that threat. We're not focusing on patient care right now. We're aware, okay, but we're tactically focused, but we're just patient aware, Okay, and then when we can switch that around, we're patient focused, but you're still tactically aware when we're applying the splint. Okay, it's going to take time to put this on. So please, again, just making sure there's no direct or active threat to you and your team. And remember that this is a dynamic situation, so it can obviously change quite quickly. So constantly communicating, constantly lifting your head, asking your patient to scan as well to give you a hand, just making sure that the environment you're operating in, it's still safe to be in that space. Okay. Obviously, just not leaving your patient alone, not that you're going to do that, but just something to be aware of, that if you do maybe need to leave them alone to go and get something, your comms are down, you need to go to a face-to-face chat, whatever it may be, that your patient is positioned in a way that they can engage if a threat does present themselves. So very basic, if you're in a room, make sure they're facing towards the door, especially if there's only a single point of entry, okay, so that they can engage if something does happen, all right? Apart from that, Sam's given you a lot of information. Please apply all of that. Remember all of that because it's very, very good. There's a lot of information to take away from that, and it will definitely help with the management of the fracture, okay? And just being aware of those different considerations when you're operating in a high risk, a high threat environment, okay? We're not putting a splint on in that care under fire or that direct threat. We're going to delay that to the tactical field care phase or the indirect threat. And as long as it's safe to operate in an environment, we can proceed with putting that splint on. All right. Thanks very much. I hope you enjoyed the presentation.